I will leave to the next speaker, Mr. Christian. Thank you so much.
Thank you, Dr. Taha Al-Hadamardi, and thank you, Dr. George, for inviting me. Thank you also to Dr. Sulaiman Al-Habib group. I think it's quite interesting what you have said. Let me just start. Oh, I cannot share my screen. George, will you? Okay. I think what you have said ties in to a certain degree also into my presentation, especially when it comes to patient safety and informing the patient about the steps in patient empowerment.
Carry on, Mr. Christian.
There we go.
Yes, there we go.
All right, perfect. Can you see the screen, everybody?
Yeah. Yeah.
Okay, perfect. So let me just fix this. Okay, so hello, everybody. Thank you for inviting me. My presentation is on the topic on stakeholder strategies in medical tourism, and more specifically on how to successfully build a cluster. First, a quick introduction about our company and the company I work for. The Middle East Service Center was founded over 40 years ago. We are Germany's first and oldest medical tourism facilitator, and we have within the years developed and are now operating as a full-on consultancy for hospital, medical tourism facilitators, governments, and destinations. Over our tenure, we have directly had the privilege to care for 52,000 patients, most of them from the GCC, from the CIS, so a lot of Russian-speaking patients, and also from the African continent. Our process is usually quite simple. We start really with an audit, looking at our clients' operations, seeing if everything, what the processes are, trying to understand them, and then we try to identify, of course, inefficiency and improve on these by applying what we have learned during 40 years of tending to international patients from around the globe. Excuse me. We put our know-how at the disposal of our clients, and this is quite important. Sometimes people think this is just them bringing ideas to us and we are trying to mix them up to make something new out of it. But what it really actually boils down to is looking at my personal individual experience of over 10 years in medical tourism. We have our founding partner who has been in the industry for 40 years. So we have seen over these times so many developments in the industries, in the markets, marketing strategies that have been conducted, they have unfortunately failed, and also marketing strategies that have been successful also when it comes to strategies and operations. Just a quick question, should I let everybody enter, because I'm getting the request for the people who are waiting? I will just do so. Okay. One last thing, transparency, trust, and integrity. This is quite important to us. The reason is not, I mean, it's of course important to every business, but as we are a family founded, owned and operated company, this is something that has quite importance for us. Everything that we do, everything that our employees do, that our partners do, at the end of the day also reflects back to our founding, to our family. And since we are quite rooted in the Middle East and also in the CIS, it's very important for us to never leave any kind of bad business behind. So we value the relationship to the client first, be it a patient or be it a corporate organization like a hospital. So just a quick oversight of what we do. We still operate as a medical tourism facilitator for patients who are willing to come to Germany, but we do not facilitate outside of Germany. But this is not our main operation. Dr. Taha has said quite well, it's mostly word of mouth, and this has been the same for us in 40 years. So friends of our friends and contacts who get referred to us are still being treated in Germany by our company. However, we do not actively market for international patients. We offer consultancy services in the realm of strategy, operations, marketing, press, and PR, and also legal and ethical marketing. Ethical marketing, especially, is one of my, and the legal, ethical medical tourism and legal medical tourism is two of my main topics, as you also will see in this presentation. We are also an advisor, negotiator, and we implement the strategies, of course, that we draft if the client wishes us to do so. And we also do joint venture negotiations. So, for example, we now have two Chinese corporations who are trying to strike joint ventures with the German healthcare providers, and we coming in, connecting the two parties and making sure that both of them get what they are looking for out of this cooperation. We are making sure that both interests are protected. And lastly, destination development, which basically ties into the coming presentation. So it's just not just being a place for medical tourism, you have to be a destination for medical tourism. And this is something that we value, and I'm trying to identify a few of these important steps in the coming presentation. So stakeholder strategies, medical tourism focusing on successful cluster building. First, what is a medical tourism cluster? There's regional clusters, certain groups of cities or cities that have combined their strength in healthcare to try to attract international patients. You have national clusters. I think one very good example for working national cluster is the Dubai Healthcare Experience, the DXH. And also you have local and bilateral medical tourism clusters, so two nations combining their strengths to attract patients to their part of the world. The stakeholders of medical tourism, of course, it is the international patient himself. It is also the healthcare providers. I think this is the most obvious one, as well as hotels and gastronomy, the service sector, and then two parties that are often neglected, which is the hosting state. So the nation who actually receives these international patients can use this influx of outside patients, not only in a monetary sense, but much rather in a sense to portray their medical prowess and their possibility and potential in the field of healthcare. And lastly, the domestic patients, which are often forgotten in the idea of medical tourism, but domestic patients are one of the largest stakeholders, especially in a system like Germany, where the revenue from international patients gets reinvested into the healthcare infrastructure. I mean, this is similar to other places in the world, and then benefits domestic patients. However, they often get forgotten. They cannot be managed similar to the healthcare providers or hotels, gastronomy, or the service sector. So you have to openly communicate to them the advantages of medical tourism in order to avoid any kind of discontent. Now let's look at our medical tourism operation. We have, of course, the roof describing what we are talking about, and we have then the hospitals, the service sector, and the facilitators. I've boiled it down to these, to the participants that can be managed by us, by the professionals in this industry, be it medical professionals, be it consultants like us, or even governmental offices. And unfortunately, sometimes things go wrong. You might have a group of hospitals that doesn't wish to cooperate with another group of hospitals. You might have issues within the service sector or facilitators who do not like to work with each other. But we have to understand that even though it's possible that a patient will seek out one specific hospital, he's rather going to travel to an entire destination where there is a support network. There is even though it's competitors, but they are working together to provide him with the best experience possible. And this is what, in the end of the day, attracts patients, because he's going to feel safe, he's going to feel comfortable. When we're looking at this, this has to be communicated to all the participants within a strategy to make sure that they actually understand each other and are willing to work with each other. So our job is, if we're looking at a fictional medical tourism cluster, how to bring these groups together and keep them working for a common goal. And even though they are competitors, we need to make them cooperate first and compete later. Once the patient is in the country or he has decided to travel to country XYZ, this is the time where they can start to compete for the patient. But if they start competing before it's actually decided to come to the country, it's going to be a loss to the country itself. So what we need is a foundation, as you can see in the bottom, and we need an aligning body. And I will explain these two steps in a very, very abstract and simple way, actually, just to give you an idea how they can look. Of course, we do not have the time to make a micro analysis of these, and also we would need specific information, but just looking at it, we start with the foundation. The foundation is number one, mutual finances. So everyone who wants to participate in the structure, in this cluster, has to participate in the financing of it, be it for marketing, be it for the organization, be it for the operation staff. So there have to be multiple sources of funding by the participants who are willing to contribute. We need transparent processes and also commonly drafted bylaws. The processes are very important to make sure that everybody knows what the consequence of an action is going to be and how the processes are being designed, in order to prevent that anybody thinks, well, I'm paying for this, but my competitor is profiting from it. And the bylaws are what everything is based on. They ensure that everybody really knows what the rules that they are playing are are, and what is going to happen if somebody does not adhere to these rules. So the bylaws inform the system of mutual finance and transparent processes that guarantee each stakeholder has the same chance to benefit from the structure. As mentioned, let's say you have 3 rehabilitation hospitals, all are pitching into the structure. They are going to think, well, if one of us is getting most of the business, this is not profitable for us. However, remember, the higher goal is to promote the destination itself, because this is going to translate into much more revenue in the end. And as long as the patient is satisfied, this is what counts for the moment. And in the long term, this will definitely pay off. And the bylaws also structure dispute resolution. There's going to be votes on certain topics within the committee, which is the next step. And also penalties for any kind of misconduct, be it on the side of the medical professionals or be it on the side of the administrators. Now, we'll take this case, for example. What happens when a patient sends a medical inquiry? So he goes to this facilitating body, to the cluster, and he sends an inquiry, a general inquiry. What happens with this? How is it distributed equally so everybody who is pitched in financially has the chance to benefit from them? You will have a main office operating these kinds of requests, and they will distribute the inquiries to the adequate medical partners, those who are able and appropriate to treat this patient. They prepare standardized responses by a predetermined deadline. So they have 3 days or 4 working days to respond to this inquiry. The inquiry will not be sent directly to the patient, but rather to the administrating body. And this administrating body is going to send it then back to the patient. Why are they standardized? Because if the patient ends up with 6 cost estimations and treatment options by 6 different hospitals in different design, different structure, he will be confused. We do not want the patient to be confused. We want to empower him, to give him the information on the same level, in the same format, so he can decide for himself. And the patient will then end up deciding on these responses. What is the benefits of it? As I've explained, patient empowerment, number 1, and also patient autonomy. The patient is the one making the decision. There will not be any kind of cognitive dissonance at the end of this experience, because he's the one who made the decision. Of course, if he has any follow-up questions, these will be answered. This is not the issue. The issue is just he gets the information he needs to compare the multiple options. And this is very important in making the patient feel well about making a decision. So the foundation is a legal framework that dictates how the aligning body is designed. It also informs its inner workings and provides rules for dispute resolution. And now we have the aligning body, the bar on the top. This is the committee. The committee, its function is to represent the cluster. It's to participate in outside occasions, be it exhibitions, be it meetings of the government or the stakeholders, and also to cooperate with other entities, be it nationally or internationally. When it comes to voting, we have equal votes, transparency, and tie-breaking votes. So we do not want any kind of halting in the voting procedure because people cannot decide. There definitely has to be a decision made, whatever the issue is, be it an issue of misconduct, be it an issue of marketing, but this keeps this body functioning. If you have no tie-breaking votes, what happens, and we have seen this all too often in our experience with medical tourism clusters, it just gets forgotten. We are not getting forward. And at some point, it just runs out and nobody thinks about the cluster again. So you need a way to keep these people making decisions. And also protocols, documentation, binding procedure, and confirmations, which makes sure that everybody knows about his rights and also about his duties and obligations towards the organization. Now, this is one of the cases, and this question, we get it every time. So we present this to a group of hospitals, multiple hospitals, competitors in their region. And they tell us, well, what happens if we all pitch in? We send the cost estimate, and there's one hospital that always sends in a cost estimate 10% lower than the average. What happens? Ceteris paribus, if all other things remain equal, the patient will probably decide to choose the provider with the least cost. And then the final invoice turns out to be 15% above cost estimate. and even above the average cost estimations. So what happens, the patient decided to go to this provider because he thinks it's going to be the cheapest one, but the quality remains the same. At the end of the day, it's far more expensive. And there's tools how to solve this issue. And this is what we do in our consulting practice. We bring these tools to our clients. First, you collect all the relevant data, the KPIs, the metrics, the cost estimates, how long it took to send them to the patient, the final invoices, and how high the cost estimate were. You start to detect discrepancies. It's simple analysis. And you see, okay, we have one group of hospitals. Their cost estimations are always below average, but the discrepancy between the cost estimate and the final invoice turns out to be higher. And then this issue has to be escalated. How can this escalation look? You will bring this issue to the committee. There's a procedure for it. You could either penalize this hospital in future inquiries, even though they are funding this body, but for this case of malpractice, not medical, but administrative malpractice, there has to be a solution. They could be excluded from certain procedures. Let's say they always have this cost discrepancy in issues of knee replacement. They will be for a certain period of time excluded from participating in these inquiries. And this is going to be executed by the committee. It's going to be voted on by the committee. So everybody knows it's just going the way it should. Now, if we look at this, I think it looks far better than it looked before. And it really, in our experience, works far better. The importance of having a well-structured foundation, laws and bylaws that tell everybody who's participating and who's pitching in financially what to do, how to do it, and what not to do is very important, having them being clear about them. At the same time, in the committee, you have representation. And this goes for hospitals, this goes for the participants in the service sector, facilitators, for everybody who is a stakeholder in medical tourism that can be actively managed. So not the international patients or the domestic patients, but rather the corporations in these structures. You can do this. And you have working groups. You have a working group for medical care, working group for gastronomy, working group for retail stores. And this has to be structured. It has to be fair, because when in my 10 years in this industry, I have seen so many clusters fail because people start working, they're energized, they're motivated, they're pitching in financially, and then the return is not what they expected, or their competitor has a higher return, and then they start pulling out. At the end of the day, the patient is going to be hurt, because what this structure always also offers you to do is the option to standardize and to quality control and to get far better patient feedback. As Dr. Taha has explained, it is a tool to also improve the national providers by holding them accountable for their action in the market of medical tourism. And this is very important, and it usually works quite well if implemented right. There's a few successful clusters internationally, but none that really have created a structure where you have a main office managing it. Usually it's websites and platforms where the patient can still choose himself. But we have seen patient autonomy to be the most important thing, or one of the most important things in medical tourism. And this is why we try to emphasize it and make the patient the one to decide where he's being treated. So that's it from my side. Thank you very much for your attention.